welcome back. The majority of neurotransmitters are made in the digestive tract, and of course, neurotransmitters are small chemical messengers that communicate with the brain. Up to 95% of serotonin, which is responsible for our mood, our sleep, our appetite, and so on, is made in the digestive tract. You can see the tremendous relationship between the brain and the digestion, and of course, to overall health, digestion plays a tremendous role. One of the things I'd like to talk about is irritable bowel syndrome. 1 out of 4 people in the United States has some sort of a digestive complaint, some sort of a digestive disturbance, and those are the people who have actually seen a healthcare provider, so they've made into the statistics. So I presume the numbers are much higher than that. And of course, out of those, the most common gastrointestinal complaint is, in fact, irritable bowel syndrome. And the way it presents, I see quite a bit of this in my practice, but the way it presents is alternating constipation and diarrhea, abdominal pain, gas, bloating, all sorts of discomfort, and a number of other digestive disturbances. So what are some of the things you can do if you do happen to have what's called an irritable bowel syndrome? Number 1, you need to make sure that you avoid food allergens. Food allergens are, they can be a whole list of things. And what I most commonly see is dairy, and I do not promote dairy to anyone, even if you don't have IBS, because there's no other mammal on this planet that drinks another mammal's milk. Breast milk is for babies, and cow's milk is for baby cows. With that in mind, I also don't think that dairy is the best source of calcium. Your leafy greens, seaweed, all sorts of fruits and vegetables are your best sources of calcium, not milk. Milk, in fact, causes malabsorption. It reduces the absorption of all sorts of nutrients and vitamins. Second one, of course, one of my favorites is wheat and gluten. And gluten, if you have heard me speak before, I did a video on gluten. So if you would like to learn more about gluten itself, please look at the other video. But that's a common allergen. And of course there's corn, peanuts, and soy, and the list could go on and on. Those are some of the common ones. Secondly is increasing your fiber. And of course, the one I focus on the most is water-soluble fiber, the one you find in fruits and vegetables, your oat bran, wheat germ, legumes, and legumes are your soybeans and beans and peas and so on. Number 3 is stress and emotional management. And of course, we can't avoid stress. Stress is in our lives. So what are some of the things you can do? Well, exercise, of course, is a great way of reducing stress. Yoga, Tai Chi, or breathing relaxation techniques. And of course, breathing, its most important thing about breathing is doing it properly. The breathing has to come from the abdomen. Now, if you take a breath, if you place one hand on your abdomen and the other hand on your chest, and you take a breath, now, if your upper hand, the one on your chest, moved, that means you're breathing from your upper portion of your lungs, which means you're not fully oxygenating your lungs. And of course, breathing alone can reduce your blood pressure, can slow down your heart rate, can improve your moods, energy, and have profound effects on digestion. It can truly improve digestion and help with IBS symptoms. Last but not least, of course, nutritional and supportive treatments. And I won't go into the specifics of them, but some of the teas, herbal teas, and herbs in general that I think you could benefit from simply by finding those in the stores are chamomile, valerian, rosemary, slippery elm, peppermint. Those are some wonderful complements that can truly make a difference in your symptoms, even if you don't have IBS, but you have gas or bloating or any other digestive discomfort. You can truly make a difference. Thanks for listening.